David Minkoff. I'm Medical Director of LifeWorks Wellness Center. We founded LifeWorks Wellness Center in 1997, and I want to tell you the story about it. I was classically trained at the University of Wisconsin and the University of California. I'm board certified in pediatrics, and I have subspecialty training in infectious disease. I was faculty at the University of California and attending in infectious disease, and then I went on to a private practice and became an emergency room doctor and did that until 1995. What happened in 1995 is that my wife got sick. Now, she's actually a really good triathlete, and she began having some troubles, and then one day her right arm started to hurt and she couldn't move it, and then her left leg got numb and she couldn't move that either. And after all kinds of medical testing and specialists, no one could really tell what was wrong with her, and what they said is that she probably has MS. Now, this was very distressing because MS, as you know, is not a very happy disease. So one night, by accident, I ran into a dentist who's a natural dentist, and he said, I asked him about the problem she was having, and he said, had she had any dental work beforehand? And I said, yeah. A few weeks before, she had decided to take the mercury out of her teeth. And she had gone to another dentist who wasn't really qualified to do it, and shortly thereafter she began to get the symptoms that she had. I said to him, is this possible that this is related? And he said, yes, she's probably mercury toxic. And you better go to this doctor, he's out of town, and study this stuff so that you can learn how to do it. Now, I was an emergency room physician, and I knew a lot about acute care, but I didn't know anything about mercury toxicity. And so I went to this other doctor, studied with him for quite a long time, and learned about mercury and environmental toxins and how you can help somebody detoxify, and that these substances can cause chronic illness in people, autoimmune disease and multiple sclerosis and chronic fatigue and things like that. So I came back, and when we did the proper testing, we found out that indeed she was mercury toxic, and we worked out treatments to help her get better. And indeed, she did get better. She's back to being an athlete, and she's really fine. Now, with that inspiration, we decided that we would set up a small little clinic and see others who may have the same problem. I had a friend who had chronic headaches, and there was another person who needed chelation because their father had had an early heart attack. And so we started LifeWorks Wellness Center in the back room of a nursing office in 1997. Well, our success with patients grew, and the clinic grew, and we got better and better and more educated. And over a couple of year period of time, we were spending nearly every weekend, the two of us, going to different seminars and learning how do you actually take care of patients who have chronic illness, or how do you help athletes get better. Now, as we grew, we needed more practitioners, and Dr. George Springer joined us. Dr. Springer is a naturopath and a chiropractor, was a professor at a university teaching endocrinology, and he's a specialist in gastrointestinal issues, and he's been with us for about 12 years. He's an excellent practitioner and one of the best in the United States. Sue Morgan joined us several years ago. Sue's an advanced registered nurse practitioner. She's a specialist in women's issues. She's also a specialist in delivery of alternative cancer care. So with this team of people and another surrounding staff, we are really able to help people, not in the usual medical sense. Though I'm classically trained, I couldn't have helped my wife. And many people come to us who have been to 5, 6, 7, 12 doctors where they've gotten more and more medications in an attempt to help them, but they really haven't found the root of the problem to get them better. Now, our specialty is that. We really try to find out, why is this person fatigued? Or why can't they sleep? Or why do they have chronic pain? Or why isn't their performance what it used to be? Or why do they have heart disease? Or why do they have high blood pressure? Or why is their cholesterol high? Our solution isn't just to throw drugs at things to try to make symptoms go away or make lab tests look better. What we're really trying to do is help the person find out, why did they get the thing that they had? It's not genetic. They weren't born that way. Really, it's a discovery process. And through our vast array of diagnostic instruments and technologies, we are able to find why do you have the symptom you have or the abnormal lab test you have, and actually help you to heal your body, improve your nutrition, your lifestyle, and using nutritional supplements, and sometimes intravenous vitamins and minerals or oxidative therapies, and get better. And so we have a lot of patients, some of them with chronic illness, some of them just want anti-aging, some of them are suffering from menopause or andropause, and some of them have heart disease, they've been through surgery and they're not well. Help them to get well. We also specialize in athletes and helping athletes get better and improve their performance, because many times they're suffering from the same things that other people suffer from, only not as badly. And when we improve their nutrition and we find out what is the block in their physiology, they actually improve and they can get better too. So if you or someone you know has been through the medical gamut, you're not better, you would like to feel better, you'd like to be back to being yourself, you'd like to feel and act and look younger, then you should call us. Our phone number is 727-466-6789. We can be found at www.lifeworkswellnesscenter.com. Please call us. Thank you.